General practitioners, caring for patients, solving problems every day. We do, however, face a greater problem. Demands on health services are exceeding resources. One solution is greater integration of services. In Canterbury, New Zealand, doctors decided to take action. They developed a localised health information and referral portal. It has helped. It has spread widely. In Australia, we now have our own localised HealthPathways. What can HealthPathways do for you? It can give you up-to-date information about conditions, red flags not to be missed, helpful practice points, assessment steps, management guidelines.
For example, we looked at the seizure pathway, and so Louise had got some pathways from John Hunter Hospital and Christchurch Hospital, and actually put them together and sent them to myself and another paediatrician, Dr. Michael Rosier, as subject matter experts. We also involved a paediatric neurologist from Sydney Children's Hospital and looked at the pathway to see how we could assist GPs managing these kids locally and when to refer to our service, and then also when to obtain an EEG and where they could obtain that EEG. And so the pathways I find are excellent from looking at what we can assist GPs in managing conditions as a paediatrician from a paediatric perspective, and give them some guide as what they should refer to a clinician, what other tests are potentially required before they do that referral process, and what other allied health or nursing components should be made available to the child before they wait to see a paediatrician.
Referral pages give information about community services. Referral criteria, specialist services, did you know that neonatologists at the Canberra Hospital can manage patients under 12 weeks of age with developmental dysplasia of the hip? Referral forms are included. Save time by using our clinical and patient resources.
One of my other experiences with Health Pathways has been the ability to avoid sending a patient to a tertiary setting. So certainly working in the ACT, it's quite clear if you need to look and see whether a patient requires anti-D with a threatened miscarriage, that in fact it's quite clear how to access the anti-D through pathology, and for the patient to go and collect that and bring it back to the practice, and we can administer it at the practice itself. So, that allows us to not have to send patients at a time which is somewhat distressing through to a busy emergency department or a busy maternity unit where they'll sit and wait for hours, and we can manage that in our rooms.
During the earthquake in Christchurch, Health Pathways was the main health information communication portal. The homepage updates make this possible. New Zealand have been able to create a more efficient, integrated health service. We can do this too.
The role of Health Pathways, I believe, is useful for all clinicians. I think it's useful for GPs, either GP registrars, GPs who are just starting off in their practice, or GPs who have been in their practice for 20, 30 years. I also think Health Pathways are important for junior doctors within the health service and senior doctors to look at what we can do to help provide information back to the GPs. And so there is that health pathway is used to refer patients into the system, but also the health pathway should assist us to refer them back to the GPs, and knowing what services are available back in the rural communities that we send them back to.
Health Pathways, a free health information portal from your primary health network and local health districts. Getting patients the right care in the right place. Health Pathways. Join us and become part of the solution.